Okay, so now we are going to look at some of the very common facts and things about anesthesia. So number one is, what is the role of barbiturates in anesthesia? Role in IV anesthesia. Barbiturates like thiopental, methoxyl, ultra short acting IV agents. Primary role is induction of general anesthesia. Barbiturates are induced in general anesthesia. Second one is act within seconds to produce loss of consciousness. It produces loss of consciousness in anesthesia. Consciousness in anesthesia. Barbiturates act like that. No analgesic effects. They do not provide analgesia. So patient will have to give analgesia separately. Rarely used in today's procedure. Side effect is respiratory, depression, hangover effect, and safer agents alternative for propofol and etobidat. So general anesthesia begins with intubation of what? Intubation. Inhalation induction is used in general anesthesia. Volatile anesthetic agents like sevoflurane, halothane, and isoflurane, desflurane are used. Sevoflurane is most commonly used in the children. Another one is these are delivered via face mask or circuit from the valves. Nitric oxide may be added as an adjunct but not used alone. What is sedation? Sedation and maintenance of drugs and anesthesia. Sedation is a state of reduced consciousness but not full anesthesia. It is used in minor procedures. Anxiolytic agent is sedation, can be used like midazolam, dexmedetomide, propofol in small dose. Sedation is given through these agents. Next one is maintenance. Maintenance after induction. Anesthesia is maintained through inhaled agents like sevoflurane, desflurane, IV drugs like propofol, infusion of opioids, combination like total IV anesthetic agents, and sedation is given via IV like midazolam, propofol, dexmedetomide. These are the given. Another one is, what is induction of general anesthesia? Induction is a process in which transitioning a patient from awake to unconscious state via IV drugs like propofol, ketamine, thiopental, etomidat, inhalation, and like propofol and isosevoflurane. And another one is, goal is to loss of consciousness, no awareness or memory, smooth transition to maintenance phase. Another one is, what is inhaled anesthesia? Inhalation are used via volatile agents, sevoflurane, desflurane, sevoflurane in children, isoflurane in adults, endotracheal tube intubation, laryngeal mask, airway usage. Another one is absorbed via lungs, travel to the brain, produce unconsciousness, can be used in the induction via kits and maintenance. Then we have to maintain. Next one is, what is IV drug administration in anesthesia? Delivery of anesthetic agents directly to the bloodstream allows rapid onset. Common IV agents given like propofol, ketamine, etomidat, and midazolam should be given. Another one is fentanyl and remifentanil. Opioids given for pain, and it is used for induction, sedation, and maintenance. So in this way, we use these agents. What is maintenance in anesthesia? Maintenance is to keep patient unconscious, pain-free, stable vitally, and inhaled agents isoflurane and sevoflurane should be given. IV infusion with propofol and remifentanil should be given, or both should be given, and in this way we maintain the patient vitals are also maintained to the patients. What is the role of ketamine in anesthesia? The role of ketamine is IV IM agent is induction, sedation, and analgesia. Induction, sedation, and then analgesia. Analgesics are used to prevent pain, and unique properties of these is the associative anesthesia, preserves air reflex, potent analgesics, and increase heart rate and blood pressure. Commonly used in trauma procedures, pain and patient at the risk of the hypertension. So in this way, we can look at the barbiturates given in the IV, inhalation used with the volatile agents, induction is the first phase, maintenance, then sedation should be given, then maintenance, then IV drugs and ketamine should be given in IV route commonly for anesthesia, blood pressure maintenance, and breath maintenance. So in this way, we maintain the anesthesia.